I'm about to show you 5 Medicare mistakes that could cost you over $10,000 next year. And the worst part? Most people don't even realize they're making them until it's too late. Every single year during open enrollment, millions of Americans make these exact same errors. They stick with their current plan without checking if it still covers their medications. They ignore letters from Medicare because they assume nothing has changed. They miss deadlines that could save them hundreds every month. Here's what nobody tells you. Medicare plans change every single year. The plan that worked perfectly for you last year might be costing you a fortune right now. Your medications might no longer be covered. Your doctors might have dropped out of the network. Your premiums could have doubled. So let's dive into these 5 critical mistakes and how to avoid them. Because open enrollment only happens once a year, and if you miss this window, you are stuck with your choices for the next 12 months. Mistake number 1 is staying with your current plan without reviewing it. This is the biggest mistake I see people make, and it happens all the time. You get comfortable with your plan. You know how it works. You don't want to deal with the hassle of comparing options. But here's the reality. Insurance companies change their plans dramatically every year. They adjust premiums, modify drug formularies, alter copayments, and change provider networks. What covered your heart medication last year might not cover it this year. Your favorite doctor might no longer accept your plan. I've seen people pay $300 per month for medications that would cost them $30 under a different plan. That's over $3,000 wasted in a single year. All because they didn't spend 2 hours reviewing their options during open enrollment. The solution is simple but requires action. Every October, pull out your current plan documents. Make a list of all your medications, including dosages. Write down all the doctors and specialists you see regularly. Then compare at least 3 different plans to see which one covers everything you need at the lowest total cost. Don't just look at the monthly premium either. That's mistake number 2, and it's a huge one. Focusing only on premium costs instead of total out-of-pocket expenses is a trap that catches thousands of people every year. Here's how this mistake plays out. You see a plan with a $40 monthly premium and another with an $80 premium. Obviously you choose the cheaper one, right? Wrong. That $40 plan might have a $5,000 deductible and terrible drug coverage. Let me give you a real example. Sarah chose a plan with a $50 monthly premium to save money. Sounds smart. But when she needed her diabetes medication, her copay was $200 per month. Her total annual cost? $2,400 for medication plus $600 in premiums. That's $3,000. Meanwhile, her neighbor chose a plan with a $90 monthly premium. Higher upfront cost. But his diabetes medication only cost him $20 per month. His total annual cost? $1,080 in premiums plus $240 in medication. That's only $1,320 total. Sarah paid almost twice as much by choosing the cheaper premium. This happens constantly because people don't calculate their total expected costs. You need to add up premiums, deductibles, copayments, and medication costs for the entire year. Only then can you see which plan actually saves you money. Mistake number 3 is not checking if your doctors are still in network. This one blindsides people all the time. You've been seeing the same cardiologist for 5 years. You assume they'll always accept your Medicare plan. Then you show up for your appointment and discover they're out of network now. Suddenly your $20 copay becomes a $200 bill. Or worse, your insurance doesn't cover the visit at all. You're stuck paying full price out of pocket. And if you need ongoing specialist care, these costs add up incredibly fast. Provider networks change constantly. Hospitals and doctors renegotiate contracts with insurance companies every year. Sometimes they can't reach an agreement, and the provider drops out of the network. Sometimes the insurance company decides to narrow their network to reduce costs. The fix is straightforward but essential. During open enrollment, call every single doctor you see regularly. Ask them directly which Medicare plans they'll accept next year. Don't rely on the insurance company's online directory because those are often outdated. Get confirmation straight from your doctor's billing department. If your current doctor won't be in network with your plan next year, you have two choices. Either switch to a plan that covers your doctor, or find a new doctor who accepts your current plan. Neither option is ideal, but it's better than discovering this problem in January when it's too late to change. Mistake number 4 is ignoring your medication formulary changes. This is incredibly common and incredibly expensive. Every Medicare plan has a formulary, which is just a fancy word for the list of medications they cover. And these formularies change every single year. A medication that was covered last year might move to a higher tier this year, increasing your copay from $10 to $100. Or it might be dropped from the formulary entirely, meaning you pay full price. Some plans add prior authorization requirements, making it harder to get your prescriptions filled. I know someone who took the same cholesterol medication for 8 years. Same plan, same pharmacy, no problems. Then one January, he went to refill his prescription and the pharmacist told him it would cost $350. His plan had moved the medication to a non-preferred tier. He had to either pay the higher price, switch to a different medication his doctor didn't prefer, or change his entire Medicare plan. But it was January, outside of open enrollment, so he was stuck. He ended up paying over $4,000 that year for a medication that used to cost him $240 annually. Here's how to avoid this nightmare. Every fall, request the formulary for any plan you're considering. Check that all your current medications are covered and see what tier they're on. Lower tiers mean lower copays. If your medication is on tier 4 or 5, look for a plan that puts it on tier 1 or 2. Also check for any utilization management requirements. Some plans require step therapy, meaning you have to try cheaper medications first before they'll cover the one your doctor prescribed. Others require prior authorization, adding paperwork and delays. Know these requirements before you enroll. Mistake number 5 is missing the enrollment deadline and losing your chance to switch plans. Open enrollment runs from October 15th through December 7th every year. That's less than 2 months. Miss that window and you're locked into your current plan for the entire next year. Unless you qualify for a special enrollment period, which most people don't, you cannot change your Medicare Advantage or Part D plan outside of this time frame. You're stuck. Even if you discover your medications aren't covered. Even if your doctor drops out of network. Even if your premiums double. I've talked to people who missed the deadline by just 2 days. They called Medicare in tears, begging for an exception. But the rules are strict. There are very few circumstances that allow you to change plans mid-year. Most people just have to wait until the next open enrollment and suffer through a year of high costs. Don't let this happen to you. Mark October 15th on your calendar right now. Set multiple reminders. Start reviewing your options as soon as open enrollment begins. Don't wait until December 6th and rush through the decision. Give yourself time to compare plans carefully, talk to your doctors, check medication coverage, and calculate total costs. Rushing leads to mistakes. Mistakes lead to thousands of dollars in unnecessary expenses. Now let me give you some practical steps to make this process easier. First, gather all your information in one place. Create a folder with your current plan details, a list of all medications with dosages, names and phone numbers of all your doctors, and records of your healthcare expenses from this year. Second, use the Medicare Plan Finder tool on Medicare.gov. It's free and it's actually pretty good. You enter your medications and doctors, and it shows you which plans cover them and estimates your total annual costs. This tool alone can save you hours of research. Third, consider getting help from a state health insurance assistance program counselor. These are free, unbiased advisors who can help you compare plans. They don't work for insurance companies, so they're not trying to sell you anything. They just help you find the best coverage for your needs. Fourth, don't be afraid to switch plans if it saves you money. I know change is uncomfortable. You're used to your current plan. You know how it works. But loyalty to an insurance company doesn't pay off. They're not loyal to you. They change their plans every year to maximize their profits. Your job is to maximize your savings and your coverage. If another plan offers better benefits at a lower cost, switch. You're not stuck with any plan forever. You can change again next year if you need to. Fifth, watch out for plans that look too good to be true. Some Medicare Advantage plans advertise $0 premiums and amazing benefits. But read the fine print carefully. They might have high deductibles, limited networks, or poor drug coverage. Calculate the total cost including all out-of-pocket expenses. Also be wary of aggressive sales tactics during open enrollment. Insurance agents might call you constantly or show up at your door. They earn commissions when you enroll, so they're motivated to sell you a plan whether it's right for you or not. Don't let anyone pressure you into a quick decision. Finally, remember that you can change your mind. If you enroll in a new plan during open enrollment and then realize you made a mistake, you can switch again before December 7th. You're not locked in until the deadline passes. Let me share one more important point about Medicare Advantage versus Original Medicare with a Part D plan. This is a huge decision that affects everything else. Medicare Advantage plans bundle your hospital, medical, and drug coverage into one plan from a private insurance company. Original Medicare is the traditional government program, and you add a separate Part D plan for prescriptions. Each approach has pros and cons. Advantage plans often have lower premiums but more restrictions on doctors and hospitals. Original Medicare offers more freedom but typically costs more. During open enrollment, you can switch between these options. If you're in an Advantage plan and hate the restrictions, you can switch to Original Medicare. If you have Original Medicare and want to lower your premiums, you can try an Advantage plan. Don't feel trapped by your current choice. Here's the bottom line. Medicare Open Enrollment is your annual opportunity to save money and improve your coverage. But only if you take action. Review your current plan. Compare your options. Check your medications and doctors. Calculate total costs. And enroll before December 7th. These 5 mistakes cost people billions of dollars every year. Don't be one of them. Spend a few hours during open enrollment to protect yourself from thousands of dollars in unnecessary expenses. Your future self will thank you.